She is a licensed psychologist in Georgia and is also a sports psychologist. So she's one of those people who straddles both sides, as it were, and has the skill set of both the traditional sports psychology mental skills side that we're learning about in your master's program, and also she has that clinical experience as well. She's worked in athletic departments, she's worked with college athletes, high level. I know she's worked a lot with professional athletes. And I think one of her big claims to fame right now is that she is the current ASP president. And so we are super excited that she has squeezed us into her extremely busy schedule to make time for us here at Holy Names.
People often ask me, so are you a psychologist or are you a consultant? Like, which do you identify with more? And I don't break it up like that. I was trained as a psychologist. I'm a licensed psychologist in Georgia and in Tennessee. And when I think about what that identity means for me and what speaks to me in the field of psychology, the theoretical orientation that I really gravitated towards was cognitive therapy. And Beck's ABC model really spoke to me as well. It talks about the intersection between activating events, our belief system, and then the consequences, both behavioral and emotional. And that's still really the core of my theoretical orientation today. I like CBT because I feel like it is an orientation that allows for the clients to be empowered, right? It allows an opportunity for them to think through, if I can shift my perspective, or if I can just be aware of how I'm thinking about things and how that influences my emotional reaction and my behaviors, then it feels like I have some control over my environment and how I choose to show up. As I said, my professional identity includes both. I see myself as a dually trained professional in both the areas of mental performance consultation and as a mental health clinician. I recognize that within the field, there are those who exist in one or the other of these bubbles. And I do think that our field is large enough and has room enough for all. It's a matter of thinking through, what is it that speaks to you? What is it that you want to do? And I would say that our field is evolving. Certainly when the field started, I think most people were in this green bubble. And as the years have progressed, you have more in the blue bubble. But I will also say this, and I want to say this very clearly. If you are a consultant, I do think it's important for you to have some knowledge about pathology in order to be able to identify it when you need to refer. Similarly, if you are a clinician, I think it's important for clinicians to be trained in the skill of performance work, because it's a subspecialty area that requires training. So regardless of what your primary area is, if you're like, nope, I just want to do the mental skills and performance, or nope, I just want to work with mental health issues, that's fine. But if you're working with performance populations, you need to be trained in working with that group, because it is a unique subspecialty area that has unique concerns that require competence and knowledge in order to be most effective with them. And so I was very grateful that I didn't have to think through what was next. And this is what was born out of that, is my own business, my own practice, Gunter Psychological Services, the acronyms being GPS, and gratitude, patience, and strength are currently a big part of my professional motto. You have to have gratitude for the journey, patience to stay present, and the strength to grow. And that's how I think through my professional landscape right now, and how I show up to my professional work. And GPS is also intentional, because if you think of GPS, you're thinking about navigating, right? And navigating through different situations doesn't always mean you take the route that you plan on taking, because sometimes you have to recalibrate and reroute. But it does mean that you're going from one point to a destination, and you'll get there. You just have to stay on the journey. And these are some of the things that I think through when working with athletes, and particularly these questions they've always been salient. They became really, really salient over this past year, because we saw a situation where athletes were trying to navigate the loss of their sport or the postponement of their sport with all of the other things that were going on in the world, from navigating the pandemic to Black Lives Matter and the racial reckoning that we saw, to the political unrest that we experienced, and trying to navigate all of that while still figuring out how to put one foot in front of the other as a person, and then reconnect with their sport once we were in a position and that allowed people to do that. And so you really have to be clear about who your client is. Understanding who they are is so very important. Understanding what health looks like to them, what wellness looks like to them, what success looks like to them, what failure is like to them, right? What they're carrying with them that you might not be able to see, but they might need to unload and they might need your help doing it. Really trying to understand who your client is becomes a very vital first step in providing any type of quality intervention to those that we serve. And for me, it's the 4 P's you see here. I see my goal in the performance space as being in the position to try to help them prepare, persist, perform, and to pause. So to prepare, to put themselves in a position to do what they need to do before the competition gets here, to feel ready, to be able to trust the skills that they have, to be able to channel their thoughts and their energy in the direction that they need to, so that when they get to the competition space, it doesn't feel new, but it feels like an opportunity to showcase what they're capable of, right? Because preparation is what leads to performance, right? So helping them to prepare, feel like that's one of my charges. The second thing that I think is really big is trying to help them to persist. Challenges, difficulties, setbacks are a part of the process. Failure is a part of the journey. Doubt might show up on the journey. So my job is not to eliminate all of that, because that is impossible. My job is to help equip them with skills so that when they face challenges, adversities, and difficulties in their performance life, in their personal life, that they feel equipped to persist through them, right? Depending on the level of challenge, right? Like it might require some more persistence than others at different times. But the goal is, again, we're not going to eliminate challenges. The greats aren't great because they never experienced adversity. They're great because they learned how to navigate it and keep moving forward. So that's what the persist piece speaks to here. So prepare, persist, perform. None of this matters if they can't show up when they need to, right? And so thinking through how we help athletes and how we help performers to show up when they need to and do what it is that they need to do when it matters most, right? If we have you with excellent preparation and excellent practice, and it doesn't translate to the competition space, we've got a glitch in the matrix, right? Because a part of what we do as performance consultants is help to equip them so that they feel competent, capable, and ready to perform when they get in the space. And ready means, or that readiness in the performance space means they have a plan, but they also trust their ability to adjust should they need to. And then I add the P for pause, and I think this is overlooked, but once you have prepared, you persisted, you performed, you need to pause and evaluate what you did. Take note of what went well. Take note of what needs to be adjusted so that you can incorporate that into your preparation the next time. And so this is kind of a cyclical thing that I think occurs with performers. But for me, this has become the way I think through it is what are we doing? Are we trying to help you prepare, persist, perform, or pause in this moment? And which are you doing, which aren't you doing, so that we can help you create balance in sport and outside of sport.